Hello, everyone. I'm so happy to be sharing this time with you and my brilliant colleague, Dr. Sahar Lashin. I'd like to say a few words about Dr. Lashin before we start. Dr. Sahar Lashin, who is trained as a board-certified integrative gastroenterologist in Egypt, made her transition to the US about 3 decades ago, where she was a professor at UCLA. And as if that was not enough for her, getting a second residency in functional medicine, she decided to become also a board-certified anti-aging medicine, which has a lot to do with hormone metabolism. And for that, she went all the way to Switzerland. She did her training there, not only in what we refer to as anti-age medicine, but also biological medicine. So Dr. Lashin is extremely trained in helping all of us move ahead in these times of stress, when we feel like our lives need to have a little juice to move on. She's the right person to talk to. My joke with Dr. Lashin is that there are not enough walls in my office or her office for us to hang all her degrees. She seems to collect them. And so you are going to be in very good hands tonight as we talk about testosterone metabolism in men, and also known as male menopause or andropause. For those of you who have not met me, my name is Dr. Edison de Mello. I'm a board-certified functional doctor, integrative doctor, and also a trained psychologist. So I integrate both Eastern and Western medicines. And my idea of medicine is to meet my patients before I meet their diseases. I want to know who they are, and I want to be able to understand the function that disease plays in their lives, if any. In other words, connecting the dots. I'm the founder of the Akasha Center, which is now going into its 25th year. And I am supported by an immense, talented group of professionals. Dr. Maggie, who is a naturopathic doctor, Dr. Kutsai, who is a gynecologist, who has joined the practice, Dr. Dow, who is an osteopathic doctor, and Dr. Brent Boston, who started as a physiatrist and moved on to also become an integrative and functional doctor. We are also assisted by incredible PAs, Jenna Galvez being an expert in regenerative medicine, and Susan Powell, also an expert in regenerative medicine, ultrasound, wave machines, and in addition to that, we have other great professionals at Akasha, including our acupuncturist, Dr. Chow, and our incredible front office, without whom we wouldn't be able to be here discussing this meeting with you. So without further ado, I want to start by defining what andropause is, right? In the literature, it's called andropause or male hypogonadism, meaning our gonads start producing less hormones. The gonads, the part of our body, in male bodies that can produce hormones, specifically testosterone. So that declines with age. Just like menopause in women, men go through what's called andropause. And it's not as accentuated as in women, where there is a roller coaster that you women know what I'm talking about. When you hit that age where things start to really go down, your hormones start to become less and less optimal. In men, it's actually gradual. It's low, it starts very gradual. And hormone metabolism in men, and also in women, but we're talking about men, start going down at the age of 30. So when you hit 40, then the hormones start going down even faster at the rate of 1 to 2% per year. And so you can imagine what that does to a man who is 50, who is 40 years old, right? We start complaining about not having enough stamina. And I can tell you that for myself. I'm 66 now. And when I turned 50, I could see that my hormones needed to be replaced. It took me a little while to get there, personally, because I was still learning a lot about hormone metabolism in man. But once I got more and more into the research, I realized that there was no way I could be productive. I could have my cognition intact, my muscle mass, going to the gym, working out, building some mass, which we all lose with age, right? Our skin starts to sag, our neck starts to sag. We all know that. Our memory is not the same. So this is the benefit of hormonal replacement therapy in men, and of course in women also. And so what it does for us is it increases once you replace these hormones, they're going down, and you replace them after extensive labs, including sometimes blood and urine together, so that we can have a whole spectrum of what's happening with your hormones. We can see that once we find the magic dose that you need to be replaced with, the men come back and they say that a light bulb went on. They feel more vital, they feel more connected to their partners, they feel better about themselves, they feel better when they look at themselves in the mirror and they say that they have, that their skin is not sagging as much. It can even improve hair growth, believe it or not. You have a lot of sites out there talking about how to prevent baldness. And one of the things to do is actually make sure that your hormones, male hormones and female hormones, are balanced. So testosterone is not only to help you feel good, to help you have better body mass, to help you feel better cognitively speaking. It also fights chronic disease. So those of us who are at high risk for cardiovascular disease, for example, hormonal replacement therapy would do really well for those people who have a history or concern about cardiovascular disease, right? So if you look at your levels and they're low, let's talk to a cardiologist about what's going on with your heart, but it's also talk about hormonal replacement therapy. It also improves things, chronic immune compromising conditions, diabetes being one of them. Thyroid disease also improves with testosterone. All of that, which Dr. Lashin will share with you her experience in years of doing anti-aging medicine. So I want to give the baton here, pass the baton to Dr. Lashin, and hear her explain to us, give us tips on this incredible benefits of replacing testosterone in men whose numbers are low. Dr. Lashin?
Hello, everybody. Thank you so much, Dr. De Mello. So the humbleness is one of your features, which I am learning from every day. So having a psychologist and an integrative doctor and a primary care and a family doctor and a lot of things together would just get you in place in all of that. It's all in one, which is, I think, me, including all the patients, were happy and lucky to have somebody who is as your experience is talking about yourself and others in such a wonderful, humble way. Thank you for everything. Talking about the hormones, which we enjoy always talking about, and we love seeing the difference when we replace the hormones in the right way, because there is a lot of amateurs out there that can miss our patients, and we are very protective on our patients. We want things to be done the right way, and we want them to feel the best forever. The thing about male hormones and andropause is that women have always had this clear symptoms that shows itself, and all women are expecting them in a certain time, in a certain age, and they can recognize it that quick. But men, I bet, not a single father or a single friend told you about how they feel gradually when they start losing their hormones. You will find them silently trying to manage the deficiencies. They even don't have time sometimes to concentrate that there are changes happening, although it's clear for everybody. So for example, the testosterone, which is the Superman's hormone, that's what I call it. As long as you're having testosterone, even a little bit of it, you feel like a Superman. And consequently, you don't have time to complain, and you keep working for so long, pushing yourself to the edge. And I always say, how many widows are there? Because there's a lot of men who just push themselves till the very end without even thinking that they have a problem, and then heart attack, and then they are gone. But since every single man in this world is so precious, and we would like them to be taken care of the way that women take care of their health. By the way, if I have a list every day of 25 patients, 2 are men and 23 are women. Not because women have more problems, just because men have no time to think about their health. So the first thing I would like to highlight is that please take care of your health. Stop for a minute and think that you are approaching the 40s, then it's time to make sure that everything is good. Just go to the doctor, check your hormones, see where your levels are. Don't push it to the edge till 50 when you start declining your hormones to an extent that you start feeling the difference. And the first difference you're gonna recognize is not the libido, is not the sexual function, because if you're a very busy guy, you will think about the intellectual function. So the brain functionality is directly related to your hormone balance and testosterone deficiency. If you feel that you are overwhelmed or you're irritable, or what we call dysthymia, that you're not as happy as before, or you're not enjoying work that much because you don't have enough time to take the decisions or to get it done, or to have the stamina, just like Dr. Mello said, then think about testosterone. Testosterone is not a sexual hormone. It works on every single cell that you have. It even interacts with your insulin. If you have insulin resistance, let's look into the testosterone. If you have stubborn fat, it might be because of testosterone. If you're not thinking clearly, or you cannot wake up in the morning refreshed and happy to do what you want to do, think about testosterone. If your prostate is not working that well, it is also testosterone. And other hormones are there. It's a symphony. Every member in this team has a role, but the testosterone in men has a very big role that we have to respect and take care of and observe and follow closely, not to have this dip that happens gradually and then suddenly appears. If you are having a problem like a surgery done, or an infection, or a travel, or any stress, taking a decision of quitting a job or starting your own business, or increasing the business that you have, or family member is having some troubles like elderly parents, and you're just overwhelmed and having a lot to do, you will have to make sure that your testosterone is checked right. Because when it is, you can take care of everybody else, not just yourself. Everybody will be happier. So when you think that you're doing this for yourself and for others, you will definitely have time to check your hormones and make sure that they are in the right level. If you don't have the level the way it should be, then you will start to recognize some symptoms that it might pass by without you thinking it is of significance. For example, if you're adding weight and whatever you do, you're going to the gym, you're taking care of your diet, everything you're doing is great, but still there's some fat around the waist is not going anywhere. Think about testosterone. If you are not remembering all the tasks all the time the way that you want, think about testosterone. If you have this challenges with decision making, or with interacting with others, or you become nervous quicker, or you started to feel there is some hot flashes or sweating, which is not usual. Testosterone can do that, just like women, but in a different way, a little bit different, that you might not recognize it is related to your hormones.
So, Dr. Lashin, thank you. Thank you. That was very clear and to the point. Let me ask you a question. So, what is the first step for us men to take if we if we're suspicious that our testosterone is down? And I like what you said in terms of you having if you have 25 women or patients coming in, 23 will be women, 2 will be men. And I can tell you that from my perspective as being a man, is that there's still this unconscious tape running in our heads that men are invincible, right? That we have to keep producing. And this comes from cultural background, generic background, whatever other influences are there in the world. Men feel that they will only take care of things when they break down. You see a guy taking care of his car, taking to be serviced on the dot. Every time the light comes on that says time to be serviced, those guys will take the cars to be serviced. But when the light in us starts to fade, we don't think of it as a time to go see a doctor, to go look at what's happening with hormone metabolism. So with that in mind, what would you say would be the first 3 steps that you would take to ascertain that testosterone is recommended in a particular patient?
So if anybody is turning 40, happy birthday. I would like to make sure that with the happy birthday, we are happy with the hormones too. So I would recommend anybody who is getting into the 40s to check the testosterone level. And that can be done in blood, which is the usual way that even the primary care doctor or any of the doctors he sees can do. But for us as integrative doctors, we dive a little bit deeper into how to look into testosterone and other hormones. So for example, we have a certain test here that we do that look into the details of your genetic enzymatic breakdown and synthesis of the hormones. So if we have that amount of hormone, is the whole amount working for you, or some of it works against you, which means it can take a wrong exit of your highway. And if the hormones are taking the wrong exit, they are not going to be functioning the way that we want them to do. So we need to know if these hormones are enough. We need to know if these hormones are taking the right pathway. And if they are broken in the right way, and the ratios between these metabolites are right or no. And so we order another very detailed test in urine for 24 hours to see how the levels of your hormones genetically influenced, and consequently we can expect when we replace your hormones, how long you're going to take to use these hormones. And if you are expected to use them quickly, then we put in consideration this aspect and we calculate the amount to be given accordingly. If you are a bodybuilder, I have to treat you differently than from somebody who is working by his brains in front of a computer every day and night. If you are a person who's getting ready for a surgery, I have to calculate certain things and make sure that you are healing very well after the surgery and you are prepared for this surgery in the best way, and so on. So the best way for seeing how the hormones are is to do the blood test and the urine test for the metabolites. And then we can also take a look to all the other parameters which interact with your hormones. For example, thyroid is very crucial. Cholesterol, as Dr. De Mello said, because it's the base of all the hormones to be produced. So we don't want you to deprive yourself from cholesterol, but we don't want too much either. So there is a lot of considerations that we look into, and according to your background and family history and your personal medical history and your brother and father and grandfather's history and your challenges personally in your current life and job and family. We put all the parameters together and then reach a conclusion to where we have to start and how frequent we have to look into your hormones and how we're going to follow you if we are replacing them.
So one of the things that I often see my patients being or expressing some confusion is that the understanding of the difference between bioidentical hormone versus your synthetic hormones. So I'll talk a little bit about that, Dr. Lashin, and then please jump in and help our participants understand. The bioidentical hormones are hormones synthesized from plant-based, yams being one of them, right? And tofu being another one of them, or soybeans. So they get really harvests from that, and they go through a very, very tedious process to be able to then be converted into a substance that will mimic our own hormones. So it's natural based and it's bioidentical because the structure, the chemical structure of these hormones, when you look under chemistry, under research, it really mimics the chemistry or the format of our own particular hormones. Now, when you compare that to synthetic hormones, you're using hormones that are basically coming from animals, right? Including horses' urine that gets to be cleaned up and then transformed into hormones. So can you comment on that, Dr. Lashin, from your understanding? Is there anything else that you'd say to add to the fact that there is indeed quite a difference between those two levels of hormone metabolism?
Yes, so the hormones in the market are two parts, as you kindly expressed, the synthetic ones and the bioidentical ones. Bioidentical carry the features from its name. It's biologically identical to the ones that we grew with. So if you take a young gentleman in his 20s or 30s, they will have testosterone and estrogen and progesterone and pregnenolone and cortisol and thyroid. All of them will be structured in a specific way and naturally produced from our internal organs and glands, which are used to make these hormones in a specific way. And the receptors we have are used to look into this hormone and say, yeah, that fits me perfectly well. I'm going to react and build the muscles. I'm going to react and build the bones. I'm going to react and protect the heart. But then certain things are there out in the market, and there is gray markets, and then there is black markets, and there is a lot of colors markets that bring into the market a lot of hazards with the hormones that are not well known how they are working or how they are sensitized. And even the synthetic hormones, we know that they are synthetic, and they are synthetic because they do not look exactly like the ones that we have. They are made in the lab biochemically with the special structures that might mimic or look like our hormones, but it's not the same. And because of that, when they are broken by the enzymes or used by the cells, they changed into a components or compounds that are not exactly friendly to the body. So for example, the primarine or there is long history with primarine being used in certain areas of the world, and primarine is known to increase cancer breast in women. On the other hand, when we are giving the proper estrogen and the proper progesterone for women, they are protected against cancer breast, although they are on hormones. Simply because when our hormones are not in the right ratios, we get exposure to toxicity, inflammation, infection, challenges, inability to regenerate. And all this caused the elderly people, men and women, to develop cancers. And that's why the fear that developed of cancer can develop from hormones, and then the repetition of the hormones were ruined long time ago because of some studies that were not well done. And consequently, after that, when they had addendum and they said no, after studying the population on hormones for 4 years and then 10 years, actually we found them protected against the overall mortality decreased, the cardiac attacks decreased, the cancer exposure decreased. Nobody really cared from the medical societies and, of course, the patients or the media to rectify the wrong impression and the wrong idea that happened because of some studies that the setup of the studies were not that well made. And I believe, Dr. De Mello, you have mentioned before that there is no relation between testosterone and cancer prostate. Can you please
Exactly.
tell more about it?
Yes, yes, thank you. And that's in my practice, when a man comes in and we go through the steps of identifying the levels of hormones. So at Akasha, um, Dr. Lashin, Dr. Ney, Dr. Boss, and Dr. Kudzai, and myself, we are the hormone specialists. We really look very, very intensely into what your blood levels are showing. And some of us also want to see where your metabolites are. Metabolites is when you get a hormone, your hormone is replaced. What you excrete is not necessarily the same format of the hormone or the same chemical that you ingested, because the body goes through changes, and that hormone can be metabolized into other components. So in order for us to be very comprehensive, we need to look not only at the blood level at this space and time, but also the metabolites of those hormones. What is it really doing in your body? So once we go through that steps, we take the history, we really look at family history as well, we look at cancer history. Inevitably, the question that a man has is, can testosterone cause prostate cancer? And the answer is no. Testosterone does not cause prostate cancer. However, if the cancer is already there, testosterone will enhance it. So, and I can give you an example of a patient that I recently saw and needed testosterone. And so we put him on testosterone. His levels were very low. And within 2 months, his PSA, which is the level of, it's called prostate specific antigen. It's the levels that we look at, hormonal speaking, to see how well the prostate is doing. Is that any inflammation? Is that any cancer? And PSA in high numbers can be a sign of cancer. This particular gentleman had very low testosterone, did great on when we put him on testosterone, but then 2 months later, his levels of PSA went up. So in a way, testosterone helped him, or helped me and his other doctors, diagnose a cancer that was there, that was undetectable. So in other words, to summarize this, testosterone does not cause prostate cancer. Testosterone is actually protective of most male organs. But if prostate cancer is hovering around there somewhere, testosterone will then enhance it by showing increased PSA. So that's something that I really wanted to discuss tonight, Dr. Lashin, because it's there and there's a lot of misunderstanding about about testosterone and prostate cancer. Do you have anything else to add?
So some of the patients are concerned about, will I be forever on the testosterone replacement, which is one of the things that I get asked a lot, Dr. Mello, and I believe we share patients and we know that that's sometimes a concern. But I usually tell them that if you have a great CEO, and this person decided to retire or to quit the job. What's the only way to get his job done after he leaves? Get another one, right? So we're gonna hire another one, which is the testosterone that we start replacing when the testicles, the Leydig cells, which start, by the way, to degrade and decrease in number at age 18 in men. So at age 18, you start the slope to decrease of the decrease of the testosterone. But it doesn't happen clearly except in the 40s and the 50s. And some people even can be lucky to be pushed a little bit more, but still the decline will be sudden afterwards. So every man will go through disintegration or decrease in the number of the Leydig cells, which produce the testosterone.
Yeah.
And it's not a surprise. We shouldn't wait for disasters to happen. We are integrative doctors. We proactively interfere to stop the problem from happening. And if it happens, and then we see the patients after it happened, then we try to reverse it or we try to control it to the best way so it doesn't propagate more. It's totally a complementary strategy to the classic medicine who are very well trained to take care of the disasters that happens. But for us, we want to prevent it or to reverse it or to make the disease less progressive. And we both complement each other.
Right. So one of the things that I think I've also come across, Dr. Lashin, is a man who go through testosterone replacement therapy and they come back and they're feeling better, but not as the energy is not as increased, or the cognition or the libido is not as increased as in other men who are undergoing the same treatment. And I want to share that what I see as being a reason for that, when I compare those two groups, those who do really extremely well on testosterone replacement therapy, and those men who are slow to start, a lot of it has to do with lifestyle, right? If you take testosterone, no matter in what format, and we're going to talk to you about the options available, whatever format of delivery testosterone is available for you, if you don't add a lifestyle modification to that regimen, you are likely not going to benefit as much from it as you could otherwise. Yes, there's going to be some benefits. You're going to see increased cognition. You're going to see better libido, but not to the extent of other men who are exercising. And I say 45 minutes to an hour minimum, 3 times a week, including aerobic exercise, right? People who are working on that diet. At Akasha, every patient who is undergoing hormonal replacement therapy is given a chance to speak with our nutritionist. And we have an incredible team of functional nutritionists that includes Edison and Kyle, who are there whenever we need them to be able to come in and tell us what is it that, what kind of foods the patient can eat that will enrich the optimization of testosterone. So exercise, diet, stress. What's your cortisol level? What are you doing to distress in addition to exercise, right? Are you a person who sweat the small things? Are you learning of how to look at the bigger picture? And if not, do you have a circle of friends, of family, or your partner where you can be able to talk to or to talk about what's bothering you? Because when your cortisol is high, it rains on your parade of hormones. So no matter how much of an improvement Dr. Lashin and I want our patients to have, if your cortisol is high, we also need to work on that cortisol to bring it down. And at Akasha, we do have an adrenal component to every hormone metabolism that we do, including adrenal support, adrenal complete, to be able to decrease the levels of cortisol in people's blood, and to also be able to tell them that cortisol is anti-everything. It's anti-insulin, it's anti-testosterone in a way, because it decreases its optimization. And the other thing that I think is important for people to really understand is that it takes time. It's not a quick fix. You're going to see a difference, but you're gonna see more of a difference as time goes by, and as you stay compliant to the various formats of delivery of those hormone replacement therapies that we're doing. So lifestyle, diet, mental health, emotional health, spiritual health, exercise, all play a big part in how successful your hormone replacement can be. And Dr. Lashin, do you have anything to add about that?
Just that we have a lot of tools to recognize the deficiencies early on. We just need the gentlemen to be more aware about their health and to keep some time for evaluations so they can continue doing a great job the way they do in their life. And I was always wondering that having Dr. De Mello representing Adam on Earth, can you please tell me what's the first terrifying sign that would bring a man to your clinic?
Libido. Okay. We men are, some of us are really connected to our well-being, to how we perform in between the sheets. And that's how men, most of us, are designed. It's that whenever things are in the way of our sexual performance or enjoyment, that's when men come in. And when they come in, Dr. Lashin, the first thing that I do is take an inventory of where they are. Because if are they not having a good experience in between the sheets, in the bedroom, because the relationship is not doing well. So if the relationship is not satisfying them emotionally and otherwise, no matter how much testosterone we're going to be able to increase in that man, it's not going to be optimized to the level of highest performance, because the emotional connection is not there. Whereas women can make that connection so much more quicker than men. They can connect their bodies to something that's going on other than sexual pleasure or performance. A man, for the most part, comes in when their libido is low, or when they don't have productivity to the way they used to have. Remember, men, whether we are modern men or old-time men, men of the old country, men of the new country, what binds us together, the common denominator, is that we think of ourselves as having to be productive. That's the common denominator. We think ourselves as providers, even though women are providing much more demand these days, for the simple fact that there's 52% of women out there and 48% of men. But still, a woman will be able to come in when she feels there's something slightly off. A man will wait until the next shoe drops before he will come in. And so I tell you, my fellow men out there listening to this, we can do this differently. We can be connected to our bodies in a way that it's not only about sexual function, it's about overall well-being. It's overall thinking ourselves in a more positive light. It's about looking at our own mortality. We know we all have an expiration date. It's only a matter of time, right? But we can look at our mortality as something that's going to inspire us to live more fully in the present. And so that we don't have to wait until we get sick to then go fix what needs to be fixed. We can fix it now. So when is the better time to come to a doctor? Well, certainly everybody who is sick needs to go see a doctor, But if there was a time for you to come to look at your overall health and well-being, it would be when you're not feeling sick. It would be when you can sit down and say, here's how I'm doing. And then together with Dr. Lashin, myself, or our other colleagues, can then do an inventory of your health and saying, okay, you're doing well here. How about in this aspect of your life? Are you happy with it? So taking an inventory and being curious about your overall performance, your overall well-being, I think is the name of the game. Dr. Lashin, can you tell us a little bit about your approach to the treatment component of hormone replacement therapy?
Yeah, let me just add a little thing that libido is one of the latest things that is lost. So there is so many other things and functionalities in men that precedes libido. And that's why if it is reaching the libido level, there is already a lot of things that has been compromised on the way. So the testosterone has been suffering for long enough till people can get to the level of loss of libido. Although, yes, Dr. DeMeo, that's the driving force for men to come to the clinic. But sometimes it's important for men to come when they have lack of focusing or memory troubles or some brain fogginess or lack of energy or the stubborn fat around the waist. There is a lot of things before reaching the libido that happens, which might be important for you to recognize, to go to the doctor, not to reach the level of loss of libido. So the different ways, back to the question, that we can replace the testosterone with, as we said, testosterone is not a solo player. It is a very important player in the team. So we have to replace testosterone, but we have to pay attention to pregnenolone and estrogen and progesterone and the pituitary health and the adrenal gland with the cortisol and the thyroid gland with its production of T3 and T4, lots and DHEA and DHT, all the hormones that we take care of either by making sure it is enough or making sure it's not too much, is important for the testosterone to be adjusted. Specifically, that some people think that taking testosterone on its own is sufficient. Sometimes testosterone take the wrong exit, go to estrogen. Instead of having your testosterone working for you, it's now working against you. It's adding your weight, it's causing your emotional ability to be higher. You're gonna have troubles concentrating. It's gonna be very challenging to take care of your health. So when you have troubles, seek attention and evaluation of all aspects of hormones. And when you replace, you have to replace the testosterone among other hormones. And we have also to manage your hormones subsequently afterwards. So the ways that you can choose to replace your hormones and your testosterone depends on so many things. It's very personalized approach. It's very tailored approach to you and your lifestyle and your priorities. But in general, we have headlines of testosterone that we follow. So there is injections, which has been there forever. There is gel or cream that can be used, and there are the pellets, which I am very fond of for several reasons. I'm going to talk about the pellets, leave the other part, which Dr. DeMille is extremely expert in. The pellets I got invested in when I tried personally, and I didn't know that it can change my life that much. It was a game changer by all means. And the same day I got my first pellet inserted, I slept extremely well, so deep that day. So the relation between testosterone and sleep is very strong. That's one thing. Second thing, in 2 weeks, the pellets start to reach its top level. And building up in the body, we need few sessions of testosterone pellets because I cannot shock the body, which has been deprived for a long time from testosterone, specifically if there is other medical aspects that I'm taking care of, like obstructive sleep apnea or anemia or diabetes or overweight. There is a lot of things that I have to consider in my calculations for the amount of pellets and amount of testosterone replacement that I'm going to start with. Once we insert the first pellet, the expectation is it's gonna work. For some people, it will work for 2 months, 3 months. Some people, it will work for 4, 5 months. It is influenced by many things. Your activity. Are you in the gym every day building muscles and preparing for your marathons, or you are working on a desk? If you are consuming a lot of testosterone, then it will finish quicker. If your thyroid is in a good shape, or if it's winter, or if it's summer, or you are traveling across the continents, or you are stressed because of a lot of other changes in life, all this have to be considered. And by the way, adjustments of the amount of testosterone follows all of the above. So if your thyroid is lazy, I have to increase your testosterone a little bit. If your thyroid is adjusted or on the higher level, I have to decrease your testosterone a little bit, and so on. So calculations that we do, at the end, we have number of pellets that we insert, and then according to how long it's gonna work, we have to tweak and adjust a few months every time. First year, I always say, give your body 1 year of adjustments so you can be on the cruise afterwards.
Great.
So you try few times, and we try to adjust according to how you feel clinically and how we find in the labs. And then we put all together and we refine the doses further. It's all bioidentical. And some people are afraid that, oh my God, I'm going to insert something in my body. Well, what you're inserting in your body will last for 3 or 4 months. It's nothing that you should be afraid of because it melts away after a few months. That's why we need to re-put it again every few months. So rest assured, if you don't like it, wait for a couple of months, it's gonna go away.
Thank you,
Dr.
Dr. Lashin.
Dr. DeMello, Dr. Lashin, those are great information. We have a question on our chat. Is testosterone something that a man could start at an older age, say 70s? This is from
Yeah,
Stacy.
yeah, that's a question from our dear patient, Stacy. Hi, Stacy. Hi, David. Yes, indeed. Testosterone can be started at any age. There's no age where there's a limit, or where, it's not recommended we start. If a man feels that his energy, his cognition, his metabolism is slowing down, if he's active and he wants to use testosterone, I highly recommend that he considers it, and that Akasha will do a very comprehensive dive into their patient's history. We can also counsel people who are in other states and even other country, even though we certainly we're not going to be able to prescribe. We can give them an educational educational tips on how to address this with their own doctors and what to look for. So Akasha does both in-house assessment and also telehealth assessment.
And can I add that the oldest patient I had on testosterone pellets was 93 years old?
Yes.
And he used to fly all the way from the Middle East to see me in the US every few months. And he was running 5 companies of his own. Extremely sharp, extremely functional. And it was, for him, it's a lifestyle. It's a quality of life.
Yeah.
When you have your hormones in the right levels, your quality of life and your functionality is unlimited. It's endless.
I agree. I agree. And I'm not quite 70 yet, but I'm getting there. And I'm a perfect example. I haven't felt, I don't feel my energy. It's a day past 40. I caught it at the right time, and I keep using it, and here's the result. So yes, don't let age stop you from doing anything that you want to. You still wanted to come talk to us. Any other questions out there?
I would like to open it up to anybody who would like to first ask questions on our forum here. You could put it in chat, or we could just go ahead and get started. We have a lot of questions from info.
Okay.
Okay, I could get started. Let me go here. Thank you, both of you, for this lovely presentation. Can hormone replacement help with mental clarity and mood?
Yes, yes, yes. And a big, big yes again.
Okay. Thank
Yeah,
you.
so our brains are very, very dynamic, and it needs a lot of what we refer to as phospholipids around our brains. All the cells around it, they have a membrane that protects those cells, the organs, and those are called phospholipids. Well, guess what? Cholesterol is a lipid, right? And so when you have a brain that have enough testosterone, you are enhancing main brain activity. You are enhancing what we refer to as synaptic responses. Your synapses are firing better. So the answer is yes. In fact, it's one of the main reasons why women come in. It's not only because they're feeling the change is really getting to them, but also they feel brain fog. And that's because of decreased estrogen as well, which we men also have. So when we talk about testosterone replacement, Dr. Lashin, Dr. Dombo, Dr. Ney, Dr. Boston, and I, we all look at your overall hormone metabolism, not only testosterone, but what is the men's level. We also have progesterone, we have estradiol, we have prolactin. So we look at everything to balance it out so that our adrenals are at its best and most enhanced capacity.
Thank you.
It also helps in decision making. Can you imagine if you're procrastinating about buying this car or selling your home or changing your jobs or quitting or starting something new? Your testosterone will influence your decision making. You will find yourself taking decisions more courageously. You will find yourself more smoothly taking the steps that you have been postponing and taking one step forward and two steps backwards. You'll always find yourself taking steps forward after your hormones are adjusted well.
Good, good.
Okay, thank you. I have two more questions in chat. Do men experience cycles in their testosterone like women?
Yes, absolutely. We do, guys. Guess what? We do. And that's why it's called andropause or man menopause, right? It goes into cycle. Remember, testosterone starts decreasing at age 30, very slowly. By the age 40, you're now losing 1 to 2% a year. And so a lot of us will wait to have it replaced because some of us are exercising, which can increase testosterone. Some of us are eating better. Some of us think, okay, my diet is what it's making me tired. It's the amount of sugar. It's all true. Diet, the amount of sugar you drink, the lack of exercise, lack of water will all decrease your mental capacity, and testosterone will decrease it even further. So if you are looking at increasing your mental capacity, you need to think about lifestyle, as we have talked about, and also testosterone metabolism, testosterone replacement.
Okay. Okay, we're running short on time, so I'm gonna kind of go through the questions a little bit faster. This one question's for you, Dr. Lashin. What testosterone levels are considered too low or too high?
Well, it's totally individualized and personalized. So it
Okay.
depends on who is this person, how big or small this person is. and how much functionality. Are we exercising every day, or we're not? Are we dealing with other medical conditions? Do we have obstructive sleep apnea? Do we have diabetes? What's the condition? So it's totally relevant to a lot of other parameters, and that's why it's extremely individualized and personalized. And I see a lot of group chats on Facebook and social media and Instagrams asking each other, what's the best level that I should be at? It's just like asking, how much food should I eat today for lunch? It's totally different. It's very personalized.
Yeah, yeah, I agree. There's another question that somebody just texted, which is a very good question, which is, will hormonal replacement therapy curb your own natural production of testosterone? This is from our friend Jeff. The answer is yes and no, right? Because bioidentical hormone is perceived as by the body as one of its kind, it can be seen as endogenous. Endogenous means everything that's coming from within. Whereas synthetic hormones are exogenous, they are synthetic. Their metabolism, their receptors are not as tightly bound like this, right? A key and a lock. It's not as not as tightly bound as if you're doing the bioidentical. So in bioidentical hormone replacement, we don't see a side effect of decreased hormone metabolism if you stop taking it. Certainly, your cognition is going to suffer a little bit, but it's going to go back to the way it was. It's not because you started replacing it. So whatever the reason is that brought you into the office for hormone replacement therapy, if you stop it, the bioidentical ones, you're going to go back to the same level before. No different than if you're taking a blood pressure medication to regulate your blood pressure. If you stop taking it, your blood pressure is going to go up. But if you are on the synthetic hormones, specifically the injectable ones, then yes, there's been research there that shows that it can indeed decrease the body's own natural production of the hormone.
I can add a little thing as well, that those gentlemen who are young and still having to have a family and kids, we highly advise that they have to be on Clomid or Clomifen, which protects the size of the testicles from getting smaller with the replacement of hormones, and also protect the fertility. So those who want to keep the fertility, if they are still in early age, semen or sperm, we have to keep that in a bank just in case. And also we protect the fertility by the clomifen, but we usually advise by doing both, keeping sperm in banks and taking clomifen. And it is not common to have people in 20s or early 30s with a big problem with testosterone, except if there were certain reasons for it. If they removed the testicle for a cancer, or they have been exposed to chemotherapy, or something like that. And we definitely, everybody knows that if you are delivering food from outside, the kitchen might not be that functional. Either because of this, you are delivering the food. So if you are taking testosterone, it's because you don't have enough anymore or anyways. So that's why you're seeking the replacement. Or if you are having some, but it's not that efficient or good enough, then you will need the support anyway. But yes, it might affect the internal production over the long run and might decrease the size of the testicles if you're not on clomifen.
Yeah, and Dr. Lashin, there's a very good question here that I'd like for both of us to answer. And the question comes in two parts. Part number one, does testosterone therapy affect hair growth or hair loss? And I know that you have in your other clinic an interest in hair replacement therapy. So, and the second part of that question is, does it reverse fat gain in men? Which the answer, of course, you've already answered, and it was yes. But let's answer those two questions in tandem. How does it affect hair growth or hair loss?
So if the testosterone takes the wrong exit from the highway of your pathways, then it will go more towards the DHT. DHT is dihydrotestosterone. It's a metabolite of the testosterone, extremely powerful, strong hormone for men to have, but it causes baldness. And if you are in your 20s or 30s and started to feel some baldness here or mere recession in the front of the head, we have to immediately evaluate your hormones and block this pathway. There is ways to block it and clean the body from the DHT and redirect the testosterone into the right pathway. That's one thing. Having the fat, the resistant fat around the waist, this means that also the testosterone is taking another wrong exit from the highway in your highway internally. And this means your testosterone is genetically directed to go towards estrogen more. And I have seen even doctors who didn't know why they are not losing weight, although they are doing everything right. And when we check their estrogen, and we found it high, and we were able to clean the body and do the detoxification, they lost the weight. And definitely when we block the wrong pathway of the testosterone and redirect it to the right way, we can keep the hair and grow the ones which are lost by the machines that we have. And we can also keep getting the testosterone in its higher levels in the right pathway by monitoring the treatment that we are giving.
And that's one of the reasons why previously when we talked about how to assess for testosterone metabolism, we look at both blood as well as urine, because the urine can tell us exactly where the testosterone is going. As Dr. Lashin said, which exit is the testosterone taking? And that can only be done when you do a comprehensive 24-hour urine, which we do at Akasha as well for some of our patients. There's another question that I think is very important, and I know we are a little out of time here, but I'm going to push a little further. And that question came from one of our own amazing staff who is asking, how does pellet replacement or hormone used as pellets, how did that affect a woman's cycle?
So the testosterone pellets that we insert most of the time in postmenopausal, one of the first things that quit working for the ovaries when the ovaries is about to retire is testosterone. So women in their 40s, late 30s can start having loss of libido and vaginal dryness and difficulty achieving orgasm. All this happens because of the little amount of testosterone that women have in their bodies. And when this is deficient, the loss of sexual desire happens. And it became clear. I had a patient telling me, I don't really want to fix my erectile dysfunction because my wife told me, forget everywhere from the umbilicus downwards, I'm done. And that was like, oh, wow, we need to fix you both. So
Right.
yes, testosterone is very crucial in the intimate health and the sexual function of women, and replacement of testosterone not only regain the intimate life, but also help in the lubrication of the vaginal walls and protection against UTIs and vaginal infections, and even the sense of well-being in women as well.
So as we thank you, Dr. Lashin, as we wrap up, what I think that question pertains to is that, yes, hormonal replacement therapy works well when both genders, including people transitioning from one gender to the other, as we know. And if you're in a relationship, it's even better when both of you can ask yourselves, would I benefit from hormonal replacement therapy if I'm feeling so low? Because what may happen psychologically speaking is that one partner is doing really well hormonal-wise, right? Cognition, libido, stamina, and the other partner is not. So that can cause a little friction in the marriage. So at Akasha, a lot of the guys who come to see us, they come in because their partner encourage them to come in. Or
Yes.
their partners make the appointment. And I want to tell you guys out there, my fellow man, that yes, your partners can make the appointment, but you too can take control of your own health. You don't have to suffer quietly. This is the 21st century. Hormonal replacement therapy is not the next frontier, it's the frontier because it's already here. We talk about it in Western medicine when I'm at the hospital, for example. Oh yeah, the hormonal replacement therapy is the next step. It's not the next step. It's never been the next step. Hormonal replacement therapy has been in existence for a long time, for decades. All we're doing now, we are understanding our own bodies better. And so therefore we have better products that can attend in a more natural way to what the body needs. So listen to your body, it talks to you. When you're feeling anxious, when you're feeling tired, when you don't have enough energy, ask yourself, what could my body be telling me? It speaks to you, it tells you what it needs. The question is, are you here? Are you able to listen?
Does testosterone therapy impact people with MTHFR issues?
Yes. So MTHFR, it's called methyl tetrahydrofolate reductase. It's a big fancy word to means that these are people who have an enzyme deficiency where they cannot break down B12 as readily as most of us. They need a particular type of B12 called methylated B12. And because that methylated B12 will also enhance energy, will enhance more metabolism, and because there's also a connection with those phospholipids that we talked about. Remember, we talked about phospholipids being part of the brain cells, the membrane that protects it, that also feeds it. Indirectly, when you have MTHFR, if you are also optimize your hormone metabolism, you are optimize your adrenal glands, which can then benefit from both the specific kind of B12 and the hormone replacement that you're doing.
If I may add the cherry on top, that we have this specific program for intimacy and sexual health in Akasha and the other clinic in Orange County, your other branch. We do have machines here and there that also complement the hormone replacement, which is ultrasonic, that I always say we have the stimuli and the hormones, and we have the machine that we work on it, which can be the penis or the vaginal area. And this area needs to be regenerated and renewed, just like we regenerate anything in your home or your street. So you need the pathways, then the connection, the blood supply, the nerve endings to be sharpened, developed, just like Dr. De Mello said, with the connections getting more together, so the enhancement of pleasure would reach different level. And this can happen with combining the replacement of the hormones with the machines that we have in both clinics.
Okay, wonderful, Dr. Lashin. Yes, and just a little more before we close, and that we are, like Dr. Lashin said, we are present in 2 locations. In Santa Monica, it's directed by me. In Orange County, it's directed by Dr. Lashin, which is at Utopia Medical Clinic, also a part of Akasha integration. So, and whoever you need at Akasha, you can see both of anybody, either in person or also telehealth. You can reach us at info@akashacenter.com, and Anna and her team will be happy to answer whatever questions you may have in terms of logistics of coming in to see us or doing telehealth. So without further ado, thank you all of you for joining us tonight for this what I hope was a very dynamic conversation about about the fact that there are better ways for you to feel better. That's the bottom line. What are the better ways out there for you to feel better? And hormonal replacement therapy is undoubtedly one of those better ways out there. So thank you all and have a good evening.
Thank you,
Thank
everyone.
Dr. Lashin, thank you so much.
Thank you
you,
so
guys.
much. We
Bye.
enjoyed
Bye,
the
everyone.
talk.
Bye.
Bye, everybody. Thank you.